I was born in Kibera, stayed all my life here. Life is so challenging here. There is violence. Unajua ni ghetto. Saa kuna vitu mob, unaona wasi wakifanya, pia unataka kufanya. I can't say I was a bright student, but I think nile pressure ya teenagers. I met this guy and we were so in love. In the process, I got pregnant. I had to drop out of school and take care of the child.
The Health Literacy and Behavior Change Project in Kibera was a collaboration between Ministry of Education and UNESCO with the support from the government of Azerbaijan. It focused on the issues that relate to adolescent girls between the age of 10 and 19. And Kibera, being an informal settlement area, was a place of interest. There was a noticeable trend of high dropout rates among adolescent girls because of a number of issues, one of them being early pregnancies. Others would drop out of school as a result of drug-related issues. We wanted to know what really is affecting the girls and to see whether we would have interventions that would ensure that they are retained in school, they are able to progress through their education and complete the various levels, and hopefully gain employment for themselves.
From the very tender age, if the child is not prepared, nourished, and given access to health facilities, it would impair learning. UNESCO's role in general is about, really helping to build standards and norms. There is also capacity builder. And in anything we do, we try to look at how can we build capacity that would address the issue. And this is a project where there has been real engagement with government and government institutions, because one of the products of this project is to ensure that the capacity of teachers and education sector personnel are built in order to, one, deal with policy, and two, in enhancing change.
The main role of the Ministry of Education was to offer policy direction and guidance in line with the existing policy documents, first beginning with the National Education Sector Plan that seeks to retain all children in school and ensure that at least they complete a minimum of 12 years of basic education. But we also brought on board our colleagues from Quality Assurance and Standards and the Kenya Institute of Curriculum Development, because one of the deliverables of the project was coming up with instructional learning materials that would help in mentorship and guidance and counseling for the girl child. This project targeted public schools as well as the non-formal schools or complementary schools. These are private schools, community-based schools that are started by the community.
Essentially, if you look at the two things we're trying to do, it's health education. And we need to ensure that there are materials relevant to the kind of information awareness that we want to create. But it's also important to provide the guide for the teachers that will be using the material, and also training the teachers that would eventually have to work with students on the material.
The onset of this project began by identification of a sample of schools that would participate in this project. The Ministry of Education first engaged the master trainers, and in engaging with the master trainers, we brought on board specialists in health literacy, as well as officers in the ministry that coordinate the HIV and AIDS unit.
We moved in and tried to see the key issues that made the adolescent girl child miss school, even as far as having a one-on-one talk with the girls, and they came up with what really bothered them, and that's where we commenced on the journey to the making of the materials for the project.
Kenya Institute of Curriculum Development is an agency of government, and they're the ones in charge of curriculum development, and they have the mandate of vetting all materials that are developed for use in schools. So together with Quality Assurance and the Kenya Institute of Curriculum Development, then they were able to train the teachers and the master trainers so that they would come up with material that was relevant to the context in Kibera.
We look at content because we want to ensure that the content is appropriate for the level of the learner. We also want to ensure that this content does not have factual errors, that there are no typographical errors, there are no editorial errors because they are being used by learners. We also want to ensure that the content is current, that you're not giving statistics or you're not using terms that are outdated. The organization of material, it is a logical flow, a sequential flow. Even the general outlook of the book, the font size, is it appropriate for the level? Then we also look at illustrations, that they're correct, because it's not uncommon to come across illustrations that are wrong.
The first meeting towards the development material was very crucial because we were the stakeholders who tried to modernize the material, and we had to change everything in terms of language use, spelling mistakes.
It is important when the teachers involved, because it is the teachers who are going to implement. And when you develop something and you drop it down to somebody to implement when it was not there initially, sometimes it becomes a challenge.
After the training of the master trainers, we adopted the cascade model, where you get to train the master trainers, then they go down to schools to train the teachers.
On these topics we are trying to discuss, and the materials we have given you, find which material is necessary to be merged in which material.
I became a master trainer after the training that was conducted on health literacy on adolescent girls, and to be more specific, the adolescent girls in Kibera, the challenges they are facing and how the challenges can be solved in a school situation through life skill training. As a master trainer, we use facilitation as the main mode of training, as opposed to lecturing or any other system. We give the teachers the materials, they go through them, they discuss, they present, then we guide them in accordance to the education policy and the way the objective of the material requires us to do.
Children are good at observation, and they learn more when they see things.
They interact and they acquire new skills.
The training really was very superb, excellent, well presented by the facilitators.
The education materials are so informative.
We can be able to help these children understand their emotional and also how to cope up with their physical growth.
The instructional learning materials that we came up with in this project were both print materials as well as audio. In some cases, the children were able to come together and perform short plays and poems that were educative in nature. In some cases, we used the radio, and the children were interviewed and recorded, and this would be played out to the girls and the boys in Kibera.
Asanteni sana mpenzi msikilizaji, hawa wanafunzi, my brothers na my sisters zangu. They are part of a pilot project ambayo inasponsoriwa na UNESCO na wako hapa kuact. Kwa hivyo ukisikia hizo majina utakuwa unazisikia tena sana wakati ambapo utakuwa kwenye acting. Wanataka kuchant na mavijana kuhusiana na story ya drugs and alcohol abuse.
Kuna key messages. First ni understanding. That there are internal as well as external pressure that our youths face when they are going through adolescence, and especially life in areas like Kibera.
Our curriculum agency had to look at what curriculum intervention in terms of instructional material was being developed, and this material was evaluated and vetted before being proposed to the ministry for approval.
For us to evaluate, we have a procedure of how we do it. We call for submissions and they all submit for us to be able to look at it. When we do it with the assistance of teachers, officers from the Ministry of Education, teacher trainers, then they sit together to build a consensus so that the final mark they give is one that they have built consensus on. We have a ministerial technical committee that sits. We submit to them the reports, and they're the ones that make the final decisions on the books that pass. And assuming that they meet the threshold and they pass, then they will be in the orange book so that they can be used by all learners in the country.
I believe when we talk about gender, it's not only about the girl child. And it's good that in sensitizing girls, the boys are there. It's like a check for the girls, and it also helps the boys to be aware. Because if the boys are not aware, it will not help. Remember, the focus here is for behavioral transformation.
Peer group pressure iliniweka nikaingia kwa drugs, nikaanza kuvuta bangi. Nikaona hiyo life hainipeleki vizuri. But kulikuwa na jamaa mwingine alikuja, akaniongelesha, akanisponsor, nikarudi shule mpaka nikamalizia dizia. Turn peer pressure into peer support.
Lazima ni make future yangu kwa sababu future yangu ni very important.
Yeah. Get the facts, not the drugs.
The peer-to-peer model will be very effective according to my experience as a teacher, because when this one has experienced maybe abortion and the other one has not, so when they are peers, this one who has experienced the bad experience will tell the peer, and this peer will most likely avoid sex so that it does not get involved in abortion.
Mi nataka vijana wajue kwamba wajachelewa kuacha madawa za kulevya. Mi nilitumia madawa lakini niliweza kuacha. Naweza wasaidia pia vijana kama mimi wawache wasifikie pale Florence alifikia. I stayed out of school for 4 years, but fortunately for me, I had my family. So they helped me to go back to school. I registered and hopefully, inshallah, I'll pass.
Sexual health information will bring more change because kwa shule zingine hawako na hii information. So vijana walikuwa na misbehave, au abstain. So hii information itawasaidia sana. Jo hakuwa najua.
Our school had a lot of pupils bullying other pupils. So with these materials, it has helped me to introduce an anti-bullying policy in the school.
We have different subjects where the health literacy can be used, like social studies, religious studies, science, and life skills. Teachers, I think, will find it useful to incorporate that in teaching some of the subjects.
All the teachers who are going to get involved in this are going to work together with the parents to guide the child so that the child feels that it's taken care of from both ends.
We have piloted the project in Kibera and it has turned out to be positive.
So we're looking at government taking it as a good practice and working with other partners. This is a project, but going forward, it needs to be a program, ensuring that there is a more integrated approach for social inclusion.
And we'll look into possibilities of scaling it up based on the success that will have been recorded in Kibera to similar contexts within the urban areas, especially the informal settlement, and also other parts of the country. And as we push towards education for sustainable development under the SDG goals, the ministry's intention is to say that there is no child left behind in our education reforms, and that we are able to cater for each and every child